Cerebral palsy is a central nervous system disorder. It can happen due to prenatal, natal, or postnatal causes. It can be infection, trauma, thrombosis, embolus, and then because of these insults, and a lesion occurs in the central nervous system, and then we see the results of this lesion in the motion and posture system. Cerebral palsy can be divided according to involvement site. It could be a spastic cerebral palsy in which motor neurons involved, or it could be an ataxic type or extrapyramidal type cerebral palsy. And sometimes we see the mixed type cerebral palsy. As an orthopedic surgeon, we see mostly the spastic type cerebral palsy. When we have the spastic type cerebral palsy, we classify them according to involvement size. If it is mostly common, mostly affected sites are in the lower extremities, and then we call it spastic diplegia. If the one side of the body is involved, like one arm and the same ipsilateral lower extremity, we call it spastic hemiplegia. And then if all the extremities involved, we call it spastic quadriplegia or total body involved cerebral palsy. In spastic cerebral palsy, we see the spasticity, which is a tonus increase in the muscles. And then you can kind of see that when you move the joint slowly, you will see that you can move the joint in the full range of motion. But if you do it quickly or fast, you can see there is a catch in the joint, and then sometimes you can't complete the all range of motion. That is spasticity. It's kind of velocity dependent spasticity. So when you do the range of motion exercises, range of motion measurement in slow motion, you can do it passively. And then if you make it faster or quickly, if you try to, let's say, quickly flex the knee, you can get a catching, and then it gets released like a clasp knife. This is called spasticity. In spasticity, if spasticity persists and doesn't get a appropriate treatment, then the muscles get contracted, and then later on bone problems can develop, and then joint problems can develop, like subluxation or relaxation of the joints. So when it is just the spasticity, the treatment is a little bit easier. In the local spasticity, let's say in the hips, if there's a spasticity, you can do the all range of motions and you can't see any contraction on the physical exam. But if the child evolves because of the flexor spasticity, you can see the pelvic tilt, and then because of the adductor spasticity, you can see that scissoring type of walking. In this type of cerebral palsy, we usually treat the patient with botulinum toxin. And then it's same thing happens when the child walks on tiptoes. On the exam, you can see that passively if you do slow motion measurement, you can see that all range of motion is good, within good limits, within normal limits in ankle joint. But if you do it, quickly,